Hello, I'm Natalia Bilbao, and this is Ali Khawar. Whether you're about to join the workforce, are a senior employee, or are just about to retire, having knowledge of your health and retirement benefits is crucial. But who promotes and protects these benefits? I'm excited to be joined by the Principal Deputy Assistant Secretary of the Employee Benefits Security Administration, EBSA, of the U.S. Department of Labor, Ali Khawar. Thank you so much for being here.
Thank you for
Ali.
having me.
How would you describe what the U.S. Department of Labor and the EBSA in particular does?
So if you think of the US system, people that have their benefits through their employment, whether it's things like a 401k or a traditional defined benefit pension, and you're employed by the private sector, so not state or local government, then generally you're under our jurisdiction. And so we're the primary regulator, and our job is several-fold to make sure that those plans are being operated correctly and taking care of the people that they're supposed to take care of, but also educating the public, educating the people that are running the plans, and then we write rules and there's a policy-making function as well.
What type of work do you do with international organizations?
The fundamental question that we're asking ourselves is, do we have the best system possible? What are the things that other people are doing that we can learn from? So, we might talk to the Australians about an initiative that they're doing. Some of the problems that we face in the US are not unique to us. Across the world, almost every developed economy and almost every country is facing an aging population, which means that birth rates are falling and the average age of the population is getting older and older. How you think about making sure that enough people are covered by things like the 401k, have enough health insurance, how they're going to take advantage of those benefits in old age. And so there's a lot that we can gain from having those conversations and a lot that people can learn from our conversations as well.
What do you find is the biggest challenge currently in your role?
One issue is that we're a very, very small agency. We have less than 1,000 people. The kinds of arrangements that I was mentioning, there are about 4 million of them, roughly, in the US. So we have under 1,000 people, we have responsibility for 4 million of these arrangements, and there are trillions and trillions of dollars in assets. Depending on what piece you're looking at, there's up to $40 trillion. Being so small, how can we make sure that we're having the maximum impact? The big part of that goes back to what I was saying about public education, right? Making sure that the public is aware of what their rights are, that employers are aware of what their obligations are, that we're making those things as plainly understandable as possible, and that people know that they have this resource in the U.S. Department of Labor that's there and available to help.
How did it feel for you to be named by President Joe Biden as Acting Assistant Secretary in March of 2021?
It was an exciting moment for me. I have been working in this area for a long time, and I'm very familiar with the agency's work. But to take on that role at a really critical time in the juncture of the U.S., but also of my agency, we were also, like everyone else, in the midst of COVID at that time. We were doing a lot of work around COVID, around how people can pay or not pay, as the case was ultimately for vaccines. Finding benefits from that COVID period is hard, but one of the things that I believe is that I think it opened a window in which there was a level of openness and acceptance of mental health conditions not being, at worst kind of a reflection on the caliber of that human being, but a disease just like any other, right? We don't tend to judge someone if they have a heart attack or if they break their leg.
You have a video that's really informative, actually, that showcases two cases of different workers. One has diabetes, and he kind of follows the normal route, and nobody questions anything. It's covered. And then when somebody claims they have a substance abuse problem or addiction problem, then that's a whole other ballgame.
It's suddenly their fault. But the truth is, these are diseases just like any other. And there's been a law in place actually for over a decade. It's called the Mental Health Parity and Addiction Equity Act. That stands for a pretty fundamental proposition that if the condition you're seeking treatment for is a mental health condition or a substance use condition, it shouldn't be treated differently just because it's that condition. What we found, truly unfortunately, is that for many people in the US that have health insurance coverage, that pretty simple proposition, that simple promise that it shouldn't matter, wasn't the case. That it did matter. That you had to jump through additional hoops, that you had to, cut through additional red tape for no reason except you're trying to get treatment for a mental health condition or a substance use condition. And the part that really I think I found the most bothersome is that, I'm a parent, and a lot of what you saw during the pandemic, and one of the things that did change a little bit, is there was, in addition to the mental health epidemic, there was a teen mental health epidemic, and particularly body image issues, and particularly around adolescent females. You can imagine as a parent how hard it is for your child to have any health condition, and how much that distracts you, the stress that you have with that. But then on top of that, if when you're reaching out for help, you now have to fight again and again and again, a system that is designed to say no and not help you get the care that your child needs. That really is not the way that the system should work. And so we've been working to try and address that as much as possible. A lot of what we would see, you mentioned diabetes earlier, that people would be able to, middle-aged men could get nutritional counseling for diabetes, but teenage girls that had an eating disorder couldn't get nutritional counseling, that it would be just fundamentally excluded. We're not going to cover nutritional counseling for that. Things like that, children with autism not being able to get access to ABA therapy. Those kinds of things really, really bothered us. The other one that really sticks out in my head is individuals that had opioid disorders. Part of the treatment plan there is very typically testing to make sure that you haven't relapsed. And we would find instance after instance where urinalysis, testing your urine to see if you've taken a substance, wasn't covered, even though it is for any number of conditions. So we've been really trying to do that. The new rule that we put out focuses on the core issue of ensuring that this parity exists between medical and mental health.
So we've covered health coverage. Let's talk about retirement, because I know how important the retirement security rule is for your department. And can you tell me a little bit more about it? What type of protections are you putting in place to secure this?
So when you look at the US system, many people are not covered. About half the population doesn't have coverage. For the people that are able to save through their workplace, one issue that we've seen and have been trying to address for a number of years is that when you're in this 401k system, you're asked to make a lot of decisions about, how much should you save, what should you invest in, ultimately, how should you withdraw the money when you retire. It's different than the defined benefit, the traditional pension, right? You showed up to work, you worked, and at the end, you got a paycheck for life. That's not the reality for most Americans today. We've just told them, you're now responsible for these decisions. If you make the wrong decision, that's kind of on you. And so the natural thing for most people to do is, well, I don't know anything about this. Who can I talk to that does know about it? And that's where the really important role of financial advisors comes in. The problem is that for most of those financial advisors, they don't have a legal obligation to be putting your interests first. So they could, for example, be recommending that you invest in a stock, a mutual fund, and the product that they recommend you invest in, they're recommending perhaps because it's going to earn them a higher commission. So the rule that we've worked on is really, it's a pretty basic proposition, that when you're getting that kind of advice from someone, when they're telling you that they're going to look out for you, and everything about that relationship is about putting your interests first, that's a standard that they're held to, rather than being able to kind of promise something up front and then not be held to that standard if unfortunately something went wrong.
How can people get in touch with your department for any advice, to access resources?
Yeah, so there's a lot of material on our website, which is dol.gov/EBSA. But you can also just call us. That toll-free number I mentioned, it's 866-444-3272.
Thank you so much, Ali, for spending some time with us today discussing your role and, of course, the work being done at the Employee Benefit Security Administration of the U.S. Department of Labor.
Thanks for having me.
This is Natalia Bilbao for Ali Khawar. Thank you so much for watching.